Hi everyone, my name's Angela Colson. I'm a student at the Australian College of Applied Psychology in my honours year for psychological science, and I'm being supervised by Professor Catherine Nicholson-Perry. Today I wanted to share with you a little bit about my research, and I want to talk to you about a $73 billion a year problem for Australians. This is a problem which impacts approximately 20% of our population, not to mention the flow-on effects that continue on for other people outside of that. This is a problem which has comorbidities of anxiety and depression, difficulties with social engagement and workplace issues. This is the problem of chronic pain. So the way that we define chronic pain, and I didn't know this until I started doing my own research as well, is that chronic pain is that which is experienced for longer than 3 months past the expected tissue healing time. So, for instance, someone might have an injury, we would expect that to take a normal healing trajectory. But if pain is still being experienced beyond 3 months after that healing trajectory, then we would call that chronic pain. So I want to ask you a question. For some of you, you will already know the answer to this because you'll be one of the 20% of the population that experiences chronic pain. And for the rest of you, I just want you to imagine, what would you do if you were experiencing chronic pain? For me, I know that my first step would be to go to a doctor, to attend a GP's office. And we know that 18% of GP visits are made up of people seeing the doctor to try and resolve the issue of chronic pain. One of the problems that we also know is that only 1% of those people end up seeking psychological services to deal with their chronic pain problem. We know that psychological services are effective. They're a fantastic tool for managing chronic pain for people. They're cost effective. There's many, many benefits to using psychological services to manage pain. But what we're not clear on, and what our research is about this year, is exploring what the barriers are to people accessing those psychological services. So we're basing that on the theory of planned behaviour to explore what is it in those features of a theory of planned behaviour, like anticipated affect or social norms. What is it that is either facilitating or creating a barrier to accessing psychological services in managing chronic pain? We'll be really excited to present the findings of our research that we have partnered with the Australian Psychological Society on. This year, the theme for Psychology Week is pain. So it's a lovely link in for our partnership with the Australian Psychological Society. And you can find more information about this research on Facebook. Just head to Australian Pain Survey 2020. That's Australian Pain Survey 2020 on Facebook.